Benevolent Foundation, which has been doing a lot of work and service to the society.
Thank you very much, Monica, for this introduction. I will go through a quick overview of how to take care of your lenses. Now remember, you are doing a major job by fitting an excellent lens of excellent quality, which you have taken a lot of trouble to dispense to the patient. But if you do not explain to the patient how to look after these lenses, the patient will come back in 3 months and blame you for the lens going spoiled. As you wear lenses, the lenses collect a lot of deposits, and to make sure that the lens feels comfortable, especially on an irregular cornea or myopia control lenses, you need to make sure that the surface of the lens is completely coated with the tears in front of the lens.
We can have the lights on. I think Jyoti will need to demonstrate a little bit.
Yeah,
so I think lights are better in here.
On.
So when we have the live fitting, that time we'll have those lights off, because then you need to see the fluorescent patterns. Lights सारी on कर दीजिए इस समय. I think we can have the room lights also on.
Okay, so to have a continuous tear in front of the lens and behind the lens, to make sure that the lens has comfort, you need to achieve a clean and disinfected and microbe-free lens surface. So the modern RGP material, especially the rose-K lens, which is made of very high oxygen permeable lenses, they need to be looked after properly. They need specially formulated lenses for which you need to maintain the lens surface. There are many brands available in India, but a lot of brands may not be suitable to the sensitive rose-K material. For prescribing a solution to your for your rose-K lenses, you need to have a specially made solution for the rose-K lenses. In India, there are 3 or 4 companies available who will provide you with this. Please ask the distributor how to get these solutions. At the time of dispensing, please remember that the lens comes dry. In India, because of the transportation problem, the lens will come dry to you, except for the semiscleral lens, that will come wet. But generally the corneal lenses will come dry to you. So before you dispense it to the patient, please make sure that you check that the lens has got the correct parameters that you have ordered, which comes in a little white spec sheet. And once that is established, then you keep the lenses in a fresh case. All RGP Sparkle solutions have got a case in it, and this is a starter pack which you may give free to your patient. It's very important that you give the first pack free to your patient, so that the patient understands that this is the solution that they have to use. It comes with a bottle of solution, a multi-purpose solution, and it comes with a case. So please remove the lens from the dry container and put them in here and soak them in this solution for minimum half an hour before you dispense the lenses. That is very, very important. I've seen a lot of doctors in India just give the dry case to the patient and say, now you go and do whatever you want. There is no proper formula, instruction to the patient how to maintain their lenses. Once you have done that and dispensed the lens, it is very important that you teach the patient insertion removal, lens handling, lens care and maintenance, hand hygiene, which is very, very important. Hand hygiene causes a lot of issues in India. There are a lot of children, especially when your keratoconus is diagnosed at a very tender young age, and generally what we do is we prescribe them lenses very soon after diagnosis, and these children are always playing around, rubbing their eyes. As you know, keratoconus, you need to, people feel like rubbing their eyes with dirty fingers. So it's very, very important that you tell these patients to make sure that they clean their hands and not to put their hands in their eye at any point or stage. If they feel discomfort, tell them to blink rapidly to create more tears in the eye, and that will help the patient more than actually rubbing the eye. It's very important to give the patient a wearing schedule and an appointment schedule. What I do when the patient is in my clinic is I examine their hands and make sure that their nails are clean and not dirty, dark, black, and advise the patient to keep their nails clean. That is the first thing you should do. Then I wash my hands completely in front of the patient before even handling their lenses, and then tell the patient that you must wash your hands every time before you handle the lenses, and then make the patient wash his hands in front of me. So that patient realizes the importance of washing hands. As you know, internationally, hand washing is a major important part of healthcare. Lens have to be dried. Water is not suitable for any type of lenses in India because the Indian tap water is quite contaminated. Therefore, it's very, very important to dry their hands in a lint-free towel. You must not rush the patient when you are teaching them insertion and removal. Remember, these are irregular cornea patients and they are quite frightened. In fact, they are quite tensed up. And by making them relaxed, you will find that they will learn insertion and removal much, much faster. So try not to, in my clinic I have a designated person who teaching them how to take them out. They can take as long as they want. There is a little area in which they do insertion and removal, and they can take as long as they want. There should be no problem. But this is very, very important. Now lens care is very important. What I tell my patients on insertion is to remove the lens and put it in the palm of the hand, put a few drops of RGP Sparkle, the multi-purpose solution, in their onto the palm and give them a good rub and rinse, and then pour more solution on top of it to give them a further rinse to remove all the debris from what you have rubbed with, and then you put it in a drop of RGP Sparkle onto the lens and you insert that. RGP Sparkle is not only the disinfecting and cleaning agent, but it also has a cushioning effect. So the lens will feel immediately better on insertion. Yeah, okay. So I'll just quickly wrap this up. I'll quickly wrap this up. Yes. Yes. So this is what you look for in aftercare. You call the patient back after 2 weeks, after 4 weeks, after 3 months, after 6 months, and you look for these signs. If these signs are there, you must immediately take action, either fitting or solution allergies or something else. So these are the extra cleaning that is done for all rose-K lenses. We have the intensive cleaner to clean the lens with. We have the protein cleaning tablets to soak them in PS and then to immerse the lenses in that for a period of 4 hours and then put them back in RGP Sparkle. And we have the 3-monthly cleaning of Progent. Now the Progent is a very effective cleaner. As you can see in the diagram, the lenses do pick up, especially semiscleral lenses, they do pick up hard-bound deposits. And so you have Progent cleaning. Please contact Pooja Singh here if you need more details. And the most important thing is soft lens care. In India, you don't have peroxide system, so it's very important that if your patients have got allergy issues, then to make sure that the lenses are soaked in saline solution before you actually make the patient wear the lenses. Thank you very much.